So now this is usually every patient's biggest area of concern. We're going to talk about pain control. First, I like to point out there are two different types of pain. There's chronic pain, which is pain that usually lasts more and has been around for 3 months, 6 months, or even longer. Acute pain is something that a person experiences within hours, days, or weeks. And so most of you coming into the hospital to have spinal surgery are probably going to have a mix of chronic pain and acute pain, and we do understand that. It's very important that we discuss your pain. It's very important that we use all the tools in our toolbox to help you be as comfortable as possible to participate in your therapy. And while it's important for all our patients to understand that there's no way we can make you pain-free, we're going to make every safe attempt to modify your pain so that you can be mobile, you can visit with your family and friends, and you can get back to your life. Your pain will be managed. Our surgeons leave us a variety of medications to use while you're here in the hospital with us, with things as simple as Tylenol all the way up to IV pain medication. The sequence in which our surgeons prefer us to use medication is oral medications first. Two important reasons for that. Even though oral medications take a little bit longer to take effect, they last a whole lot longer than IV pain medications do. Also, while we have you in a controlled situation in the hospital with us, we want to see what oral medications do work for you because that's what you're going to be going home on. So any adjustments that we can make in the hospital for you will put you at an advantage for sure. But don't despair if all of these things do not work. We definitely have IV pain medication for what we call breakthrough pain. Our surgeons do not like us to rely on IV pain medication as our first line of defense, but they certainly have it ordered for us so we can help take better care of you. Another thing that sometimes is very useful are muscle relaxers. When your surgeon does this surgery, they do disrupt those large muscles that run down either side of your spine, and those muscles are not very happy about that happening. And so all the pain pills in the world are not going to stop a muscle spasm. Sometimes people will have their muscles clamped down, kind of a continuous spasm. We would try Percocet, we can try this, that, and only until we take that muscle relaxer out and do that, do they find some relief. So keep that in mind while you're in the hospital, that some of your pain can definitely be due to muscle spasms. If in fact what we're doing is not working, please communicate with your nursing staff. We're very close with our surgeons and their physician assistants. It's very easy for us to get a hold of them and discuss the lack of pain control with them and try to come up with a better plan. We do ask you to use a 0 to 10 pain scale to help us understand how you're feeling because we can't feel how you're feeling. And our pain scale goes from a 0 to a 10, 0 being no pain at all, 10 being just about the worst thing you could possibly imagine, and of course everywhere in between. Now, just because you may say your pain's at a 3, does that mean I'm not going to give you pain medication? Not at all. I know your pain's a 3 right now, but in about 45 minutes, the physical therapist is going to come work with you. We would much rather treat your pain early when it's a lower number than wait till it's really high. When pain gets out of control, it's very, very difficult to catch up to. So we would rather keep you at that low, moderate level and not have to chase that pain because that can take a very long time and it's not very pleasant. Something else I do want to point out while we're talking about pain medication is our surgeons will sometimes use what we call injectables during your surgery. You can equate that maybe to going to the dentist and having a shot of Novocaine if they're going to fill a cavity. It's kind of the same kind of concept. The surgeons will use a little bit of injectable medication before they close your incision just to help you get through that first couple hours or maybe overnight. I do like to point this out because I can't count how many times I've had a patient look at me and say, why is my back burning all of a sudden? I don't understand, my back feels like it's burning. And what that is the sensation of, usually it's bupivacaine, but there are several medications. That's that medication wearing off. So if you kind of equate that to getting dental work done and having Novocaine and how you may feel when that wears off, it's kind of the same concept in your back. But it's done just to get you over that hump with some local anesthetic after your surgery. Other things you can do for pain include distraction, Relaxation, ice therapy, certainly repositioning. If you lay in one position too long, it can make you very stiff and sore. Ice does seem to be very helpful. We want to make sure there's a barrier between you and whatever ice pack we use, and we probably don't want that on your skin any more than about 20 minutes. But we can remove that and put it back on as often as we need to. Another thing I want to point out right now, heat is not your friend right now. We recommend that you do not use a heating pad probably the first 3 weeks after surgery. Most people think, oh, put heat to my lower back, that's going to feel good. It actually opens up your capillaries, makes a little more swelling to the area, which can actually increase your pain. Eventually, heat will be okay again, but we just recommend you stay away for that for a couple of weeks. Something else we recommend is diaphragmatic breathing. I know it sounds kind of silly, the relaxation breathing doesn't really help, but it actually does. We all are very guilty of when we're anxious and hurting and things are going on, we get very rigid, our muscles get tight, and we tend to hold our breath. And if we're not holding our breath, we're taking very shallow breaths. And our bodies don't like that. So if you refer to your patient handbook you got from your surgeon's office, it'll go through techniques for relaxation breathing. And I highly encourage you to try that out at home before surgery. Remember those techniques and use them while you're here in the hospital and after your discharge. Couple of more things about pain. I'm going to ask you a true or false question. My pain medication will automatically be brought to me during my hospitalization. It's very important that we talk about this because that is false. Pain medication is not ordered most of the time on a scheduled basis. It's ordered and administered on an as-needed basis because every person is different and every situation is different. The type of, the amount of, and of medication administered to everybody is chosen on each occasion that it's needed to provide the best yet the safest care for every patient. While we don't want you in pain that's not manageable, we also don't want you to be too drowsy, and we don't want any respiratory effects from opiate pain medication. Another true or false question. I can expect to be pain-free after surgery. The answer to that, of course, is false. It's not possible to be pain-free after any type of surgery. But as I mentioned before, your surgeon writes a variety of orders for the nurses to work with to help manage your pain post-operatively. And again, please communicate with the staff at the hospital. Let them know how you're feeling, and so we can do what we have orders to do to help you out. One more true or false question. I will get addicted to opiates if I take my pain medication. The answer to this is false. Pain medication used in the short term and purposefully rarely leads to any type of addiction. But conversely, uncontrolled pain can lead to lesser mobility, increased weakness, and even severe depression. Please do not try to be too tough. Please do not shortchange yourself and take your pain medication so you can get up and do the things that you need to do to get back to your normal life. Because that's why you had the surgery in the first place, right?